Good evening, or good morning, depending on where you are. It's 8 p.m. here in East Africa. My name is Robert. Thank you for joining us. And we have been educating you on different complications of high blood pressure. And we say that on purpose. There is a reason as to why we decided that we are going to have you understand the complications of the silent killer. Because, again, I don't know whether I can overemphasize that when you're dealing with high blood pressure, there is no symptom that is going to be telling you that your blood pressure is high. And that's what we call it silent killer. And we've looked at a couple of different complications. And we initially, the first time we looked at congestive heart failure, or heart failure if you like, and how that diagnosis is related to high blood pressure. And last week we looked at how the silent killer, high blood pressure or hypertension, is related to, can cause different types of bleeding in the body, and how it can damage your pipes where they are opening up, they are dissecting, or they are bulging to the point whereby they rupture, or they open up and they start bleeding. So today we're going to be looking at the silent killer, the narrowing, as we say here. And when we were looking at the previous lesson, we looked at the arteries, or the pipes. And again, we avoid using medical terminologies in our presentation, because we don't want you to get entangled in trying to understand the terminology, but they're very simple things that we're describing here. So if you can be able to, for example, look at these arteries, and they're made of 3 pipes in one. And as a result of high blood pressure, there are certain things that happens within these pipes, and they start modifying themselves, or they get damaged as a result of the sheer force of high blood pressure. So please don't forget that high blood pressure is pressure. So that pressure has the potential or the energy to damage tissues and to damage those pipes, especially when they get smaller and smaller. And as they get close to the tissue where they're supplying blood, they continually get smaller and smaller. And so if there is a lot of force, high blood pressure, they can actually get damaged. And when you look at the narrowed pipe, so again, think of the first one. It's an open pipe. The blood is flowing from one direction to the other, and there is no problem. But if you look at, as a result of high blood pressure and other risks, and we will, we will continue talking about those things in this class, you will notice that the second one is getting a little narrower, where I'm pointing on both sides, but the blood, is still flowing. Eventually, it gets to a place whereby it's actually almost like 75% narrow, and you get to a place whereby, for different reasons, and majorly, one of the major reasons being high blood pressure. And we talk about diabetes, obesity, high cholesterol, smoking, and how they contribute into these pipes narrowing. But for now, we're focusing on high blood pressure. And so when you look at the last one, it's actually narrowed enough to the point whereby blood cannot get to its destination. And when that happens, where blood cannot get to its destination, then it means that tissue basically is not getting oxygen. And some of the symptoms you're going to be experiencing as a result of these blockages or narrowing is where the tissue is not getting, of whichever organ, whether it is this pipe is blocked or is not getting enough oxygen. And that's what is going to be contributing to some of the symptoms you're going to be having. And when you look at this slide here, actually today I don't have a lot of pictures. But you look, there's cerebrovascular disease, and I will go through these terminologies. But don't remember, all this is describing pipes that are narrowed, and they're narrowed primarily today. We're talking about high blood pressure. Yes, I said the other risk, and mostly they are modifiable risks, meaning there's something you can do. There's something you can do something about. The other thing is hypertensive retinopathy, which means basically you can lose your vision as a result of the part of your eye that takes the image or gets the image getting damaged because of high blood pressure. And it's either the blood vessels, the little blood vessels that are feeding the retina, part of your eye, that gets the image. When it gets so narrowed that it does not get sufficient blood, there's damage, or as a result of pressure, that is high blood pressure that is putting pressure on the optic nerve, one of the nerves that goes to the brain to interpret that image. Then you can actually lose vision. Where you're losing vision because of what? High blood pressure. I jump cerebrovascular disease, basically, which means the pipes or the blood vessels that supplies your brain, they get narrower as a result of high blood pressure. And when we say narrower, that means that the diameter of that pipe is getting smaller. And it's getting smaller because blood pressure forces those pipes to modify themselves in a certain way that narrows that pipe. And that's all that you need to understand. If you understand that blood pressure causes those pipes to get narrowed, then it means that the damage or the diagnosis that you'll be getting as a result of that narrowing is something you could have done something about by simply controlling your controlling, preventing, or reversing high blood pressure. And it's important that you understand this. When it comes to the pipes that supplies the heart, we call that coronary artery disease. And again, that narrowing is going to take place because of different things. But one of the major contributing factor will be as a result of high blood pressure. They get narrower, and especially we're going to focus specifically on heart attacks because eventually coronary artery disease will lead to heart attack. But there are times it will not get there. But there is a place, there is a diagnosis called angina where sufficient blood supply is not getting to the tissue, to the heart tissue, and somebody will start having chest pain. And so we'll focus solely on some of these diagnoses to see what are the symptoms, the treatments, and different things. But for now, we're looking at blood pressure and how it causes pipes in your body to be small or to be narrowed, or for the diameter to be small, and that results into some of the diagnoses that we have here on the screen. And that would be chronic renal disease or kidney disease, where to the point whereby somebody actually can start getting dialysis because they cannot make urine because the tissue, the actual kidney tissue is damaged, or the vessels that supply, or the pipes, the little pipes that supply the blood to the kidney are damaged. And because of that, then the kidney does not receive sufficient blood, and that causes problems. And one of the problems that is that person will either have reduced urine, they cannot make enough urine, or they cannot, when it's end stage, they cannot make urine at all. They have to have dialysis. And why? Again, because of blood pressure. The last one I want to talk about here is erectile dysfunction. One of the another diagnosis one can get as a result of high blood pressure, because as these pipes modify themselves because of high blood pressure, and they get narrower. Remember, we're saying that the blood is not getting to that tissue, and one of the way that men achieve erection is simply by those pipes getting bigger so blood can flow into that organ. And when that doesn't happen because they're narrowed, then they have a problem achieving penile erection because of what? Because of high blood pressure. So again, as you look at the different diagnoses that we've gone through, they look complicated when you look at the terminologies, medical terminologies that we use. But for the most part, they're very easy to understand. And that's what we're not trying to teach a medical class here. We're trying, or a nursing class, we're simply trying to teach the public to understand just how complicated things can be. And that's why we call them complications, because of high blood pressure. But high blood pressure is not something that you can feel that is going up. There are no symptoms, and that's what we call it silent killer. So if you can quite understand how internally there are damages that are taking place as a result of high blood pressure, then you will take care of yourself by knowing what is your blood pressure. And we will have a session where we're going, here at MedPriva, we're going to be talking about how you take your blood pressure and what constitutes high blood pressure. But we started with complications for a reason. So if you understand the danger, then you avoid getting there because you completely understand how this is related to high blood pressure. So as I said, that this is going to be short and sweet. It is silent killer, high blood pressure, causing your blood vessels to get narrower, and when they get narrower, blood cannot flow to the tissue, the target tissue where that blood was going, and the tissue has reduced oxygen, and some of the symptoms you're going to be having as a result of that decreased blood flow because of decreased oxygen. And one of them, actually, I need to mention is peripheral artery disease, and especially when it comes to the leg. Some of the symptoms include, somebody will be walking and somehow they're just having these cramps that will not go away. But when they rest, they go away because when you're walking, your feet need more oxygen. But if you have pipes that are narrowed, let me go to this clip again. When you have pipes that are narrowed, that are supposed to be supplying those muscles, in your leg, the calf, then you're going to have pain there. And the pain is because there is no oxygen that is getting, or enough oxygen that is getting to those tissues. But when you rest, now you don't have those muscles don't demand as much oxygen, and therefore the pain goes away. Again, because of high blood pressure. So if we describe things here so that so we actually call it description to avoid prescription. And if you can be able to prevent some of these things by understanding most of these things and how they are related, then we've done our work. And again, we will continue next time. We actually, before we start focusing on diabetes, because that's also a major issue that contributes to some of these diagnoses. We will look at high blood pressure next time and how you're supposed to take high blood pressure, what it is, what are the numbers. Now that you understand the complications. Again, if you like what we are doing here at MedPriva, you can look at a book on Amazon.com written by this author, and the book is called Alter, and I think it's on your screen. Again, we are glad that you've been able to join us here today, and my name is Robert, and thank you so much for joining us today. God bless.